Hello everybody, Dr. Alex Earl here at Pure Plastic Surgery, and today is Hump Day with Dr. Alex Earl. This is the time we get to spend with you guys and discuss very important plastic surgery topics, okay? And today I'm going to talk about, once again, something that I find that my patients find it very, very hard to grasp at times. And that is, it has to do with skin laxity. I've done several talks on skin laxity before, and if you want to look at some of the original ones, make sure you go to our YouTube channel. All right, go to YouTube, search up Pure Plastic Surgery. You're going to find a very definitive talk there on skin laxity, and you can look at that as well. So tomorrow we're going to kind of revisit the topic, but from a little bit of a different angle here today, okay? So today we're going to talk about lipo belly classification, okay? What do I mean by that? I mean how I, in my mind, classify the belly of a patient to know what's most likely going to happen afterwards in terms of how that belly is looking after liposuction, and also, you know, what we should do first and what kind of treatments there are candidates for, okay? So we're going to talk about lipo belly classification, and we're going to start, I know I drew it kind of in this direction, but I'm going to start here with one of the easy ones, and then we'll move actually to one of the toughest ones, which is this one here, and then the other two are actually fairly straightforward as well. And so we'll see that this is the one that is kind of the most quote-unquote controversial. It's not really controversial, it's that the patients really don't tend to understand it, and they don't want to kind of believe exactly what's going on when you have this type of belly right here, okay? And also, I brought some examples here, and towards the end of the talk, I'm going to want to make this a little bit more interactive, so I am going to ask you some questions, and I'm hoping we get some answers to see if you kind of understood everything that I was talking about, so we can then, move forward from there, okay? So, the first type of belly, and it's kind of one of the ones that we most prefer, right, is what I call the tight belly. Tight belly, okay? And what I'm referring to here is the skin, and we have an example here of a patient that has what I would call a tight belly, okay? Why is it tight? Well, you can see there are no folds whatsoever, and there are no stretch marks. So no folds, no stretch marks, and what I do when I see a patient, I do what's called a pinch test. And I'll grab the skin and I'll pinch it and let it go and see how quickly and how far it can bounce back, okay? And if I do a pinch test here, first I can see that the skin is tight, so it's hard to pinch it, that's one thing. And then second, I can see that once I let go, the skin, boom, bounces back right away. All right, that tells me that skin has a lot of what we call elasticity. It is good quality skin. It is basically a tight belly. And therefore, I know that patient is obviously a great candidate for liposuction, but also a candidate for HD or high definition lipo or ab etching. Okay, so these are the best candidates for HD, which are the tight belly patients. Now, who are typically these patients? These are typically young patients in their 20s for the most part. These are patients who have not had any kids. So no children, never been pregnant, okay? These are patients that never smoked, okay? So no smoking, no pregnancy, young patients, okay? And just not a lot of damage. Oh, also not patients that didn't have a lot of weight fluctuations, okay, throughout their lives. They had a pretty stable weight throughout their lives, and they tend to be a little bit on the lower BMI range. So BMI perhaps 20, 22, up to 24 or so, perhaps 25, okay? But 25 is typically the kind of the limit for the tight belly patients, all right? As a surgeon, we really like these patients because the liposuction is a lot easier, okay? Because remember, we're passing this cannula underneath the skin, we're sucking the fat that's between the skin and the muscle, and if you have like over top of that, it's very easy to pass that cannula underneath there to know exactly where everything is, nothing jiggling or moving around, okay? And you tend to have very smooth and predictable results, okay? So the tight will give you smooth and predictable results, okay? Then we move on to what is probably the most controversial belly. And that's what we call, or what I like to call, the fluffy belly. Okay? Fluffy belly. What type of belly is that? Well, that's a belly, typically someone whose BMI perhaps is a little bit higher. Most of the time between 25 and 30. 30 is my max BMI, so of course if you even higher BMI, the fluffier you get, quote unquote, okay? But these are the tough patients because when I call them the fluffy belly patients, these are patients that also have never been pregnant. They've never had massive weight loss, okay? So they are a little bit on the higher BMI side, but they've never been pregnant, never had massive weight loss. Plus minus on the smoking. They could have been a smoker, but some of them have not been a smoker. And, you know, of course, genetics plays into it as well. So when I grab the skin here, I'm able to kind of pinch it more easily. And when I kind of take it out and let go, it'll bounce back, but it won't snap back immediately. It'll be like a slower kind of bounce back there. And that's what I call a fluffy belly. And with the fluffy belly, that's the one where the skin retraction is unpredictable. Okay, I don't know exactly how well that skin's gonna retract. I've had some surprises. I found some like really fluffy bellies where it really retracts really well, and that probably has to do with genetics. And I have others where they have a fluffy belly and it doesn't retract well at all. Okay, and the problem is that when you have the fluffy belly, okay, and it doesn't retract well, the skin doesn't retract well, then you're gonna have skin that looks uneven. Okay. You're going to have unevenness, you're going to have ripples, you might have, you know, kind of like wavy looking skin, all right? You're going to have uneven looking skin, and then that's when the patients get upset and they start saying that it's uneven lipo. It's not uneven lipo, okay? It's basically poor skin elasticity, okay? You have some looseness of the skin. It didn't retract well. When that happens, part of the skin retracts, the other part doesn't, and therefore you end up with an uneven looking belly, especially in this area here, which is below, around and below the belly button. You'll have some unevenness around here, and you'll have around the belly button what we call umbilical hooding. The skin wants to kind of fold over a fixed point, which is your belly button, and you create that kind of like donut shape around the skin. That's called umbilical hooding. That's due from loose skin. And it's not because, quote unquote, the surgeon forgot to lipo around the belly button. That's not what's going on. And I think that's why it's such a hard concept to grasp. So even though I kind of go over this in the pre-op, and I'll pinch the belly, and I'll physically tell the patient, I say, you have a certain degree of skin laxity. How well the skin's going to retract is unpredictable. If it doesn't retract well, it's going to look uneven. You might have lumps and bumps. It may look wavy. You may have this hooding of the skin, this donut around your belly button. If that's where to happen, it's not because the lipo is uneven. It's because the skin was loose and it did not retract well. And the solution for that then is a skin tightening procedure. If it's mild, it would be body tight. If it's moderate or more severe, you're going to need a tummy tuck. Okay? And even though I spend a lot of time explaining that in the pre-op, I can't tell you how many patients will come up to me at 3 months and say that it doesn't look even down here and I did uneven lipo. And it's like, no, that's not the case. You had a fluffy belly, you had skin laxity, okay, and that's why you have unevenness in the area. So, what do I recommend with a fluffy belly? I recommend a tummy tuck. All right, I typically recommend a tummy tuck first. All right, tummy tuck first. However, there's a lot of patients that don't want to do a tummy tuck for whatever reason. They don't want to do the scar. They want to take a chance to see it. They want to see how it does. There are some fluffy bellies that retract, right? The post-op care is incredibly important. That means your compression and your massage. You need at least 20 massages if you even want to have a chance of a fluffy belly to retract well, okay? So sometimes I'll get some pushback and they'll say, Dr. Earl, I don't want to do a tummy tuck. I want to do my BBL. And I say, in some cases, I'll say, okay, we will do your BBL first, but you have to accept the risk of unevenness. You have to accept the risk that there may be some unevenness due to the skin laxity, okay, the poor elasticity, the poor bounce back of the skin, okay, because of the fluffy belly. All right, and this can be, once again, it's going to be in patients who never had kids, never had massive weight loss, okay? Okay, they just have a little bit of a higher BMI, perhaps, okay, and just poor genes. We can't change the genes, the type of skin that we have. All right. So that's kind of the toughest one there. The next one becomes easy once again. This is what I call the loose belly. So now it's not just fluffy, okay? Because in the fluffy, things look fairly smooth, right? It's full of fat. When there's fat underneath there, the skin looks fairly smooth. But once we remove a whole ton of fat and the skin is retractable, that's when it can look uneven. Well, with the loose belly, things are already looking, kind of uneven because the skin is loose. Not only is the skin loose, but you have a lot of stretch marks. So it may not project too well here on the screen, but this patient had multiple pregnancies. She has stretch marks not only below the belly button, but above the belly button. So she's got lots and lots of stretch marks. She has really loose skin. Okay? We know that this patient is going to have unevenness. If you do lipo, they're going to have unevenness 100%. All right? And in this particular patient, then, I am 100% going to recommend the tummy tuck. And if for whatever reason, they go to someone else or they really fight me hard and they don't want the BBL, the tummy tuck first, I'll tell them that they're going to need a tummy tuck afterwards 100%. All right? That's why it becomes easy again. All right? So tight, fairly easy. More complex. If you have a loose belly, the decision is fairly easy. You should get a tummy tuck first. You really should. That's going to give you the best result. Get your tummy tuck first, then come back and do your lipo or your BBL. Okay? And lastly, we have the post tummy tuck belly. So this is someone that started like this. Okay? We said, you really need to get your tummy tuck first. They listened to us. Good job. Okay? Yeah. And got their tummy tuck first. And now they have the post tummy tuck belly. Now we have a tight belly once again. All right? It's a tight belly once again. And guess what? Now you're a great candidate for lipo. Not only that, you can potentially be a candidate for HD, high definition, okay, lipo and ab etching. All right? So this becomes a fairly easy one as well. Now, what's the issue here? So we get a couple things that patients are concerned about, which are myths. These are myths. Patients say that, Doc, if I do my tummy tuck first, am I going to have enough fat for my BBL? And the answer is always yes. 100% yes. I've never had that problem where you don't have enough fat. Okay? Why? Because when we do a tummy tuck, we're only doing limited lipo to the flanks and the waist, and that's it. Only 1,000 liters max that we can do here in Florida. Okay? That means that you still have fat in this upper belly region. Actually, all this still has some fat areas. We can still take some more from the waist and the flanks. We have the entire back to work with. And if we need to, we can always go to adjunct areas such as the thighs, the arms, the chin. Okay? So that is a myth that I try very hard to dispel, but it's out there and it's hard, and we get that question all the time. But the short answer is, Doc, will I have enough fat after my tummy tuck for BBL? The answer is yes. Okay? Second myth. Doc, if I do my tummy tuck first and then I do BBL, won't my skin get loose? I have not seen it. I have not seen it. Okay? Because that's exactly what the tummy tuck is doing. It's making you go from a fluffy or loose belly to a tight belly. Basically, you're coming around the circle. So we're removing all that loose excess skin. We're tightening things up once again. All right? And in the same way that when we do lipo in a tight belly, it doesn't become loose. When we do lipo in a post tummy tuck belly, it doesn't become loose either. Okay, so I haven't seen this. I've seen a lot of this, where the fluffy belly does not retract well and then it looks uneven because of skin laxity. Okay? So that's why my recommendation is typically to do the tummy tuck first. Okay? You want the best results from both? Do the tummy tuck first and then come back for your lipo BBL. The other thing is that when you do your tummy tuck secondarily, it is a much tougher case. That skin already has inflammation, scar tissue. It is a lot harder to stretch down. A lot of times you can't stretch it down all the way, and you end up with like a little horizontal scar up and down at the bottom, which nobody likes. Okay, but the chances of that are a lot higher when you do your tummy tuck after your lipo and BBL. Okay, so for the best results long term, tummy tuck first, then your lipo BBL. Okay, all right. So I think, I've explained this pretty well. So now we're going to get into I'm going to quiz you. I'm going to see if you're paying attention, okay? So take a look at this belly here. So this is the belly. This patient is in her 20s. Young patient, never smoked, doesn't have kids, always maintained a fairly good weight, and her BMI is now 23. All right, what type of belly do you think she has? What type of procedure do you think we can do for her?
Tick tock, tick tock.
Let's see. Any guesses here? Any guesses?
Okay, we have the first one. The Real Queen 19, she said tight.
All right. Okay.
Milan Pompey, tight. Fine Brown, tight.
All right.
DX Macedo, tight. Fine Brown, tight.
Awesome. All right.
And it keep going.
Okay.
Miss Faye, Chrissy Chris, Melly GPR, The Real Queen, Sweet Maria, Kalidana Girl, and a lot of more.
Awesome. Well, thank you guys for participating, and it's lovely to hear. You guys have been paying attention. So she has a tight belly. When she came in for pre-op, I kind of pinched the belly. All right, I couldn't get that much in between my fingers, and when I let go, boom, immediate snapback. This is a young patient, okay? She's in her 20s, never smoked, never had kids. She's got that beautiful tight skin, and we were able to do a beautiful high definition lipo for her, okay? Great candidate. She falls into this category, all right, lipo HD, all right? Now, let's get to a little bit of a tougher one, okay?
But before that,
Yeah.
can you ask our TikTok friends to send more likes because we're close to the 1,000 likes?
Oh yeah, all right, come on guys, let's do it. Let's see if we can get to 1,000 likes for this live right here. All right, thank you TikTok. Okay, let's go for a more challenging one, okay guys? Here we go. Now, here we go, we have another belly here. Now this patient is in her 30s. Never had kids, not a smoker, didn't have any huge fluctuations in weight. BMI is 27 for her. So what do y'all think about this belly?
It's Me Marsh says fluffy.
Okay, all right.
Okay, let's go. Melly GPR, fluffy.
Okay.
Comes another one. Gigi says fluffy. Miss Faye says fluffy. Chrissy Chris says fluffy.
Okay. All right, looks like we're getting a consensus. Thank you, everybody. Again, so once again, these are the tough ones. So I agree with you. I categorize it under fluffy. When the patient comes to me, I'm able to pinch some with the skin. When I let go, it does retract back, but it's not like a immediate snap back, okay? But overall, you can see that here her belly looks smooth, right? Belly looks smooth because she's never had any procedures, never had lipo before. So I go through my whole explanation to the patient. She decides she wants to try to do the lipo first, okay? And like I said, it's unpredictable, all right? And if the belly doesn't retract well, then it may look uneven, okay? So I want to show this example because a lot of patients who think, they've never had kids, never smoked, never had massive weight loss, that they should fall into this category automatically, and that's not the case. And that's why I want to show this case. It's a very, very good case here because we did the liposuction and look what happened.
Ooh.
Okay? Now,
put it closer, Doug.
We're gonna put it closer here. Okay?
Yeah.
And this is a patient of mine. This is one of my patients. So,
thank you.
Next question. What happened here? A, uneven lipo. Doc, what the hell happened to you that day? Uneven lipo. Or B, poor skin retraction and leftover loose skin. A or B? Kind of leading a little bit there, but what are your thoughts? Okay.
Okay, let's see.
So A, uneven lipo. B, poor skin retraction with loose skin. And a fluffy belly that we talked about. Same patient.
Okay, Kinsley, B. Milan Pompey, B. Chrissy Chris, loose skin.
Okay.
MFM, B. No parts Nina, B. And B, and another B, and another B.
Okay.
B,
Great.
B,
So
B.
that's awesome because that means you guys have been paying attention and you're starting to understand this concept. But if I were to just throw this one up and say some surgery group, they would say, oh, that's terrible, uneven lipo, because nobody spends the time trying to educate patients about this, okay? But why is it so important to know the difference? It's important to know the difference because the treatment is totally different, right? If this were due to uneven lipo, then the treatment is more lipo, right? You go back, you do another liposuction to try to even things out. Even if it's simply fibrosis, if it's due to fibrosis, then the treatment is, after you try a whole bunch of non-surgical treatments, the treatment is further lipo, okay? But that's not going to help lose skin. It might even make it worse, right? So you're doing the wrong treatment if you have the wrong diagnosis. So you see the unevenness there, right? It looks totally uneven down here. There's that rippling effect. There's lumps and bumps. She has that classic umbilical hooding, that donut shape above the belly button, okay? And so when she comes into clinic, I feel once again, and I can see that the skin is loose. And that's the issue that we have going on here. And it's not your typical kind of loose belly that you see when someone had multiple pregnancies, right? This doesn't look like this, right? Okay, but that's why I went to school for many years, all right, to know what I'm doing. So, but to the layman's, right, it doesn't look the same. It looks different. So that's why when someone looks there, they're like, okay, yeah, she needs a tummy tuck. And then someone who doesn't know better might look at this and say, oh my God, that's uneven lipo, she needs another liposuction. And that would be totally the wrong thing to do. Okay? So guess what we did? We did a tummy tuck. Okay? We did a tummy tuck, we got rid of all the loose skin, all right? And now everything looks very smooth. It looks perfect basically, okay? Because all that loose skin is gone, all right? So that's the difference there. So you have the right diagnosis, therefore you can provide the right treatment. If this was due to uneven lipo, you did a tummy tuck, it would still look uneven because you're not fixing any of the lipo areas theoretically, okay? All right, so here we go. All right, so I think that kind of concludes the lesson. I've talked for quite a bit, so I'm happy to answer any questions that you may have.
Yeah, before that, we reached 3,000 likes at TikTok.
All right.
That's amazing.
3,000, all right, excellent.
Yes, Doc. And we have a very important question here,
Okay.
and it's a TikTok too, and if you are the dad or the father of Miss Alex Earl. Yeah, for real.
No, my sister. The dad, oh my lord. No, I'm just kidding. Actually, as far as I know, we're not related. But it's quite amazing. I mean, I guess now there's another much more famous Alex Earl out there. And she's right here in Florida, goes to UM. So at some point we got to reach out, maybe do one of those trees to see if somehow we're related. Way back when.
The first one?
Yeah.
Okay, what does smoking do with the surgery?
All right, so smoking is very bad in terms of pre-surgery and post-surgery. Okay, so like I mentioned before, one of the issues that can lead you to a loose tight belly is chronic smoking. So even if you stop smoking for the surgery, if you smoke most of your life, that affects those elastin fibers that are in the skin. It actually kind of breaks them up, and then the skin has less elasticity and it becomes loose. So the more you smoke, the more loose your skin is, the worse ability it has to bounce back, okay? And that's even if you stop the smoking, you stop the nicotine 30 days before surgery to 30 days after surgery, okay? Now let's say, for example, though, you don't stop, right? You have nicotine on board in your system. Well, we know that when you have nicotine on board, your complication rates are gonna go way up, okay? Why is that? What nicotine does is that it takes a blood vessel that's normally this big and it constricts the blood vessel and it makes it this big, right? It causes vasoconstriction. That means less blood flow. Less blood flow means less oxygen, less nutrients, less everything that wound heal needs to heal, okay? And so the complication rate goes up. That means there's higher risk of non-healing or open wounds, higher risk of infection, and higher risk of what we call necrosis, skin dying or skin death. If you're doing, for example, a breast surgery and you're doing a lift, there's actually higher risk of nipple necrosis, Okay, so all those risks go way up with nicotine in your system.
What if you are a diabetic here?
Right. So if you're a diabetic, we can still do elective surgery on you. Okay, but we have to make sure that your sugar levels are stable and controlled. So we're going to be checking a lab that's called the hemoglobin A1C. All right, and we need that hemoglobin A1C to be 6.5 or less for any type 2 diabetic. If you're a type 1 diabetic, we accept up to 7.5. Okay, because that type of diabetes is a bit tougher to control. All right, but it can't be any higher than that. If your hemoglobin A1C is higher than that, it means that your sugar levels are not stable. And if you have unstable sugar levels, and then once again your complication rates go up in terms of higher risk of infection, again higher risk of wounds not healing and wound breakdown and open wounds.
Can the tummy tuck be affected after pregnancy, or how would that work?
Can the tummy tuck be
Effect after pregnancy.
so? Meaning if you have a tummy tuck and then you get pregnant, definitely, yeah, that it can definitely be affected. And you're very likely going to need a second tummy tuck if that were to occur, right? So typically you want to have your tummy tuck once you're fairly certain that you're done having kids, okay? Because if you get pregnant, then the skin's going to stretch out once again. That muscle that was repaired and put together is going to separate out again and get weak again. And you're very likely going to need like a secondary or like a revision type tummy tuck or basically a complete second tummy tuck after you're done with all pregnancy.
Okay, this says, please mention how lipo makes diastasis recti more noticeable.
It can definitely make it more noticeable because you're removing all the fat that's kind of over top of that, right? So where is the fat being removed when you do liposuction? So the fat that's being removed is the fat that's between the skin and the muscle, all right? Now what is a diastasis? Diastasis is a separation of the muscle. So if you have this, say, this kind of thickish layer of fat over top of it, then it's kind of being, the diastasis recti is being kind of camouflaged underneath there. But now you do liposuction, you remove a whole bunch of fat, all right? Now there's basically less of a layer between the skin and the muscle, and so that diastasis recti then becomes a lot, easier to see, if you will. So you didn't actually make it worse, you just made it so that it's, so that's more visible. All right, and that's what happens. And so then typically, if you want to fix that, then yes, you're going to have to come back and do your tummy tuck and get that muscle repair.
Dr. Earl is the GOAT, loving my new curves.
All right, awesome. I'm glad you're enjoying it.
Okay, can you do a tummy tuck and a BBL at the same time?
So no, I don't do that. I don't do that here at Pure. I don't really think it should be done anywhere, to be honest with you. But if you want to be specific, here in Florida, when you do a tummy tuck, you're limited to removal of only 1,000 cc's of fat via liposuction by the Florida Department of Health, which is typically not enough fat to be removed, and certainly not enough fat to then transfer to the buttock and hips for the BBL portion of it. So you're really not going to get a very good result from the BBL portion of it. Also, when you have a tummy tuck, you have to be on your back, right? It's ideally in the recliner. And so either if you do like a cutout or you try to work it out, you're going to be putting pressure on the hips and the buttocks to a certain degree. And of the little fat that you had, now you're going to be losing a greater percentage of it. So rather than losing your standard, say 30%, you're going to lose 50% or 60%. So it's not worth it. You're not getting really the bang for your buck there, okay? If you really want the best long-term results out of both procedures, then I highly recommend doing your tummy tuck first and then coming back to do your BBL.
Hey doc, do you make tuberous breast surgery?
Yeah, so a tuberous breast deformity can be challenging. What is a tuberous breast deformity? Well, it has a few things. One is that the areola tends to be large compared to the rest of the breast. The breast tissue tends to kind of herniate into the areola, creating that kind of like that tube-like shape. That the base of the breast is narrow and constricted, okay? And so the way to improve a tuberous breast deformity is typically to use an implant. That's one of the cases where you don't want to place the implant beneath the muscle. You actually want it to be above the muscle, okay? To completely broaden the base of the breast and reshape the breast, okay? And typically with that, you're also going to add what we call a donut or circumareolar mastopexy as well. These cases can be challenging. Sometimes it may require like a touch-up, as a secondary case, just to continue to improve. But these are also cases where the patients are super satisfied because it's a complete, almost kind of reconstruction of their breasts.
Can we take 5 more minutes? Because we have a lot of questions.
Okay,
We have 5
yeah.
minutes?
All right, yeah.
Okay.
Let's do it.
Okay, let's do it. So this one asks if you can do a tummy tuck in a patient with a scoliosis. So the back.
Yes. So technically, unless it's very severe scoliosis, yes, we can. So as long as the patient though is able to flex well and has no issues with that, then yes, we're able to do a tummy tuck. They have, I would say, mild to moderate scoliosis, not with severe scoliosis.
What are your thoughts on breast implant illness?
So breast implant illness is a subject that has garnered a lot of attention recently, especially in social media. So there's a lot of groups out there, Facebook groups that talk about it and things like that. Okay. Now, if you look at the research, right? I'm not talking about an individual case here or there. I'm talking about basically the scientific research that we have from our journals in plastic surgery and elsewhere. There has been we have not been able to have a true correlation between implants and the symptoms of breast implant illness, okay? All right, so now at least not a true causation. It hasn't been demonstrated the implants cause the symptoms of the breast implant illness, okay? Now, there are some patients where you remove the implants and they feel better. There are some patients where you remove the implants and they don't, okay? And that's part of the issue there. If you go to the official recommendations by the Aesthetic Society and the American Society of Plastic Surgeons, if a patient is complaining of having symptoms and wants their implants removed, that's okay. You can simply remove the implant and do like a partial capsulectomy. A total en bloc complete capsulectomy is actually not necessarily recommended by them. Okay, they show no difference whether you do that or not, and when you do that, you can have increased morbidity and potential complications for the patient.
Doug, the last one. Do you go over the patient's ideal BBL outcome shape the day before surgery?
Right, so yes. The short answer is yes, but it's incredibly important. So that's why I like to see all our patients at least a day before surgery, so that we can go over all their goals, okay, and the shapes that they like and how what their expectations are, and I can determine, based on their foundation, based on their type of belly they have, okay, based on what their wish pick is or their vision board, whether that is something that would be achievable, okay? And yes, it is my job to tell the patient whether their expectations are realistic or not, okay? And I will admit, sometimes I struggle with that because I don't like to make people feel bad, right? That's why I'm in this, that's why I'm a plastic surgeon. That's why I do what I do. I like to try to make people feel good about themselves, bringing up self-esteem and self-confidence. And so it's a tough conversation when somebody comes in and I'm like, what? This is completely unrealistic. Please throw away your vision board. There's no way we can do that. It's a tough conversation to have because I don't want to hurt anyone's feelings. But it is my job, and it is something I have to work on to make sure that that I set the expectations in a frame that is realistic to what the possible outcome can be. Okay? All right, everybody. Excellent. Well, I think this was a really important one. Once again, I'm glad all of you that were on here. I think that understanding this concept is not easy, but I think with the way that we kind of framed things here today, it's a little bit easier to understand. And then once again, remember that we're here every Wednesday on Hump Day with Dr. Alex Earl, and I look forward to seeing all of you next week. Ciao.